Good morning, everyone. I'm so delighted to be here today. And we have a guest here, Ted. He is sharing this with us in person, so thank you, Ted, for coming, and also all of you that may be on phone or on your computer. Welcome to our program today. My name is Geraldine Kohút, and I've been here many times. I just love the area. I love everything that Mary Angelo does, and it's just a wonderful place because she really addresses the needs of our older adults with fun things to do, and sometimes you have to get a little serious, so here I am with some seriousness. Again, I work at Cathedral Village, and I am their community liaison, so I do go out and about to provide educational programs for older adults, or I always say happy seniors. But now with the pandemic, we all have been on Zoom. So Mary Angelo said we can do it in person, small group, and the rest of you are at your computer or phone. So I welcome everyone. Today's topic is diabetes mellitus. Okay, have the routine now. The overview. Diabetes mellitus refers to a group of diseases that affect how your body uses sugar or glucose, because you're going to hear glucose throughout the presentation. Glucose is vital to your health, as it is a required source of energy for the cells that make up your muscles and tissue. But also, glucose is also your brain's main source of fuel. Now you know how important that is. Diabetes is a global epidemic. Think of these numbers. 382 million people worldwide are living with diabetes. The World Health Organization predicts diabetes will be the 7th leading cause of death by the year 2030. Now that does sound ominous, and it is. And diabetes, in all of my research, because I do health programs on all types of concerns that we may have as we grow older. Certain diseases, Alzheimer's, Parkinson's disease. But I think this one is something that is so challenging because we're always on the cusp of getting the cure there, but we're never really there. But they have done such hard work to get us where we are today. More than 36 million Americans, or 1 in 10 people, are living with diabetes. 1 in 10. More than 88 million people have prediabetes, which means they have a blood sugar level higher than normal, but not quite high enough to qualify as having type 2 diabetes. So you understand there is two types, type 1 and type 2. There is also prediabetes, and that gets you to the point where when you have a blood test and your level is up, your physician and yourself are going to watch what your levels are, because it's again saying that you might be predisposed to it. Type 1 diabetes, type 2 diabetes, reversible diabetes, pre-diabetic, we've talked about. It again means the blood sugar levels that are higher than normal but not high enough to classify as diabetes. Gestational diabetes occurs during pregnancy but may resolve after birth of the baby. So it's not a normal thing. Everybody doesn't get gestational diabetes, but there are a few pregnant women that do, and it generally does resolve, but it's something that they have to watch closely during their pregnancy. The symptoms of diabetes: increased thirst, frequent urination, extreme hunger, unexplained weight loss, fatigue, irritability, blurred vision, frequent viral infections. So you see, this is what happens with both diabetics, 1 and 2. You start getting those symptoms, and sometimes you overlook them, especially when you have some weight loss. You think, well, that's a good thing, I'm losing a little bit of weight, but also if it's unexplained weight loss, and it's more than a pound or 2. The fatigue can be caused by something else, but these are the general symptoms of diabetes. When do symptoms appear? Type 1 diabetes, the onset can appear very suddenly. Type 2 diabetes may come on gradually or sometimes no signs at all. That's why this disease, as I mentioned, is really puts the burden, so much of the burden, on you as a person to say, well, I have some symptoms. I don't know what they are. Should I go to the doctor? Always, if you have certain symptoms that are not clearing up, so you're really thirsty all the time. I mean, you could just have that water bottle around you and you never feel satisfied. That might be one symptom, or fatigue. It could be another symptom, but if you're having a sense of something's not right, go to your doctor, get some blood work done, and you'll ease what's happening to your body. Type 1 diabetes can develop at any age, though often appears during childhood or adolescence, and or people under the age of 30. Symptoms often are noticed quite quickly. So this is type 1 diabetes. The person's own immune system destroys the cells in the pancreas that makes the insulin. That's an important factor to realize, that you know that you can take insulin, you have diabetes, but it is made by your own body. The cells in the pancreas makes the insulin. But in type 1 diabetes, the body cannot make insulin. It's lower amounts. Insulin injections begin at this point. Now, the one thing about the type 1 diabetes, I will never forget this. My husband's in higher education, and we were living at the time at Penn State while he finished his doctorate. And I was a nurse in the health center of Penn State. Now, you know, it was long ago because they don't have a health center anymore. There's this huge, huge hospital at State College, which is wonderful, and they needed it. But in the interim, they had this lovely health center. And I was a nurse working 3 to 11 shift. And two fellas came in. The one fella did not look well at all. The other was helping him into the unit, the health center. And I was really shocked. But then again, you know, it is State College. You have a nice looking tall fella sort of slumping over, thinking, well, what was he doing? Perhaps was he maybe consuming some alcohol? I'm not saying that's your perception, but it was an unusual sight to see. So I introduced myself, got the fella in a wheelchair, and his friend was going to wait for him. So then we got him up on a stretcher, and we always had a physician that was right there at the health center. Because if you know State College at all, you don't want to drive too far away at night because you may get stuck in something. So we had a physician there. The physician came in, took all of these vital signs, and because he was starting to get really disoriented, she took some blood tests there that she could read right away, and here he was a diabetic. His blood sugar was sky high. It had to be like almost 400, which is, I mean, you're really going to crash. So what happened, she got him immediately into an ambulance and actually took him to a hospital in Bellefonte, which is about a 15-minute drive. So he was seen there and he died. Now, this is a very sad story because he had no clue as a student that he was sick. And the roommate or friend said, he was never like this. This is something new. But I will always remember that. I'm saying this because it can develop at any age, and it develops fast when it happens. It just says, my slide says, symptoms often are noticed quite quickly. The person's own immune system destroys the cells in the pancreas that makes the insulin. So we already talked about the pancreas, but with type 1 diabetes, it destroys those cells. This is when insulin injections begin. When to see a doctor. If you suspect someone in your household may have diabetes, or you are noticing symptoms, contact your doctor for an appointment. It is so much better to be safe than sorry. If you have already been diagnosed with diabetes, you will need close medical follow-up until blood sugar levels stabilize. So with the medications that we have today, you can absolutely become stable. You can eat, certain foods are better for you, and you go into this lifestyle, which if you are a type 1 diabetic or even a type 2 diabetic, there are certain things that it's your responsibility to do the things that are going to keep you well and safe. Okay, so we're just talking about diabetes, and we just talked about when to see a doctor. And as soon as you have any of these symptoms of diabetes, see that doctor, and then you'll know best options for you. understanding diabetes. Well, insulin is a hormone that comes from a gland behind and below the stomach called the pancreas. The pancreas secretes insulin into the bloodstream. This is what happens normally. The insulin circulates, enabling insulin to enter your cells. Insulin lowers the amount of sugar in your bloodstream. As your blood sugar level drops, so does the secretion of insulin from your pancreas. This is the balance. So therefore, not only does the body have the pancreas where insulin is made, but the body also recognizes when your level drops, you don't need that insulin anymore. So the pancreas has a little rest. So if you think about that, it's really an amazing factor that your body can take care of the amount of sugar that you're eating with the pancreas, which is a gland. And the pancreas recognizes, oh, that sugar is too high, we're going to get that insulin out. If the blood sugar comes to normal, we're going to take a little nap now. So this is basically how it's done. Now the role of glucose. Glucose, sugar, acts as a source of energy for the cells that make up your muscles and tissues. So sugar is the energy. Glucose comes from two major sources, food and your liver. Sugar is absorbed into the bloodstream where it enters cells with the help of the insulin. Your liver stores and makes glucose. When your glucose level are low, the liver breaks down stored glycogen into glucose to keep glucose level normal. Again, the balance. This is what the body does. And that's a good thing because we do have many people that have diabetes, but if you don't, that balance is always taking place. Causes of type 1 diabetes. Well, it's a combination of genetic susceptibility and environmental factors. So if you have diabetes, type 1 diabetes in your family, parent, grandparent, you are susceptible to getting diabetes. The environmental, I think, is very interesting because it does say susceptibility, which would be your genetics, and environmental factors. Well, polluted water. Again, it's in combination. So you might be drinking polluted water. The soil in your backyard could have some stuff in it that can create this susceptibility. Lack of physical activity. That's really significant, especially as older adults. You want to do this throughout your lifespan, but boy, as we age, we really have to start thinking, my body is going to need my help for us to stay stronger and healthier, so that physical activity is just wonderful. Vitamin D deficiency. Oftentimes as we age, you'll notice your doctor will have a request blood test done for vitamin deficiency because it shows up other issues. So next time you go to the doctor, if you want to, or have either one of you had a vitamin D level taken?
I've never heard about it.
Well, that's good. That little tips that you hear at these programs are helpful if you want to, or just look vitamin D deficiency up. But all of these are in combination. It's just not one thing that causes type 1 diabetes. Your immune system, which normally fights viruses and bacteria, destroys insulin-producing cells in the pancreas. Talked about that pancreas providing that balance. This leaves the person with little or no insulin. Sugar builds up in your bloodstream. Weight does not seem to be a factor in type 1 diabetes. So the sugar is building up. It can't break down, and that's when you start thinking of the insulin injections. Causes of prediabetes and type 2 diabetes. Well, prediabetes can lead to type 2 diabetes. Your cells become resistant to the action of insulin, and your pancreas, that gland we're mentioning again, is unable to make enough. Sugar builds up in your bloodstream. Again, genetic factors are playing a role, but being overweight is strongly linked to type 2 diabetes.
Could you go back to the previous slide? I want to read something.
Yep. Hold on, let me get backward. Okay.
Your immune system, which normally fights viruses and bacteria, destroys insulin-producing cells. So my immune system is destroying the insulin-producing cells?
Yes, your immune system, which normally fights viruses
and
bacteria, destroys insulin-producing cells. It's the cells that they produce in your immune system.
It's for type 1 people.
Yes, right, the type 1. Thanks for clarifying.
Okay, we can go with that.
Okay. And we can talk afterwards too, no problem. So, I already talked about that, and now we're going to go to causes of gestational diabetes. Well, during pregnancy, the placenta produces hormones to sustain the pregnancy. These hormones make your cells more resistant to insulin. They're just working on getting this baby born healthy and alive. Normally, the pancreas responds by producing enough extra insulin, but sometimes your pancreas cannot keep up. When this happens, too much glucose stays in your blood. Your risk for developing prediabetes and type 2 diabetes later does increase. Now, after the baby is born and you had the gestational diabetes, most often, I would say, I'd like to use a percentage, but I know better when you're doing it to talk, because with diabetes, I can tell you, doing this research, it kind of changes an awful lot. So the only thing I am saying, that if you have any symptoms, or you know someone that's pregnant, or your granddaughter, make sure that they're aware that this can happen. But in most cases, after the baby is born, you're okay. But it's that extra burden on your body that produces this. Risk factors for prediabetes and type 2 diabetes. Weight. The more fatty tissue you have, the more resistant your cell becomes to insulin. So the heavier you are, the cells really say, well, I don't want that insulin anymore. You know, I just want to do my thing. Inactivity. The less active you are, greater risk. Again, we talked about family history. Parent or sibling has type 2 diabetes. Race, higher risk people of color, Hispanics, American Indian, Asian Americans. Age, risk factor increases as we age. So all of these statistics, there was, in doing the research for this, there was actually under race, each race displayed significant issues that they have at a higher rate than others. And so it does list all of them, but you can, again, go online to find out what is the difference, what makes this happen, and that reason is not there. They just really don't know, but they're saying it is at a higher rate. High blood pressure, 140/90 is linked to type 2 diabetes. Now, you know when you go to the doctor and they take your blood pressure, and they sort of, well, first of all, they take it as soon as you get there. And mine is sky high when I get there. So then they know that. So they say, well, why don't you just rest a little bit? I'm thinking, thank goodness. And it doesn't come down that much when you're just sitting in the doctor's office, because you're scared to death that you're going to be put on a high blood pressure pill or something's going to happen to you. So anyway, that's the average, 140/90. Higher triglycerides and cholesterol levels are linked to type 2 diabetes. Polycystic ovary syndrome, again, linked to diabetes, and that would be for the woman that has menstrual cycle, excess hair growth, and obesity. So, you know, when the doctor is examining you, obviously they know all of these factors, and they're going to ask you these things, especially if you go in and say, I'm just not feeling that great, I'm always thirsty, I'm fatigued. So these questions are going to be part of his, let's talk a little bit, Jerry. Complications. Long-term complications of diabetes develop gradually. The longer you have diabetes and the less controlled your blood sugar is, the higher risk of complications. So these are all of the complications that can occur if you have diabetes. Cardiovascular disease, nerve damage, kidney damage, eye damage, foot damage, skin condition, hearing impairment, Alzheimer's disease, and depression. Okay, so can you say that when you leave this today, you're going to be very alert to the fact that these are the complications that occur in concert with the diabetes. And again, if there's any family member, you know, just be alert to all of these things that we're talking about, and stay healthy, and make sure you go to your annual or every 6 month checkup with your physician. Prevention. Well, for type 1 diabetes can't be prevented, but healthy lifestyle choices may help in treatment. So type 1, you have it, you're going to be taught how to be safe with your diabetes, what to do with your diabetes type 1. but there's really, and good lifestyle choices. Type 2 diabetes with significant weight loss and exercise, it can reverse the disease. Now what that means, generally you're going to lower that sugar level. You are going to lower it if you lose weight, and it can reverse it. It's really hard to do, but you can do it. And that means that you just don't do it for like 3 months and you say, this is great. I don't have to take anything. My by-mouth drugs are covering me. Absolutely they are. But remember those things that, it is a lifestyle. It's not just a 3-month situation. The focus is always on permanent lifestyle choices. You eat healthy foods, lower in fat and calories, and high fiber. Get more physical activity. Aim for 30 minutes daily. And I love this. If you get 30 minutes every day, you can break up that exercise. Sometimes they say, just do 30 minutes, you're going to feel good. Well, as we age, 30 minutes is a long time. So you can break it up. Even if you're walking, let's say we were just going to walk around this room. We're going to walk around the room for 5 minutes, walking at a good speed. And that's 5 minutes, so you have 25 minutes left to go. So I think that's really good, and I've looked that up. A lot of places, a lot of organizations are recommending that now. People don't want to do all of these things, and they don't have the time or the physical fortitude to do a straight 30-minute exercise, but you can do it in spurts. The A1C test, A1C blood test. Well, when that's ordered by your doctor, you are kind of curious, and this is what it's for. Glucose in your blood normally binds to hemoglobin in your red blood cells. So when you take a blood test, that blood is going to go in this little tube, and they're looking for the hemoglobin in your red blood cells. The A1C test measures how much glucose is bound to red blood cells for the last 3 months. This little blood test is really good because they can just see it under a microscope, and it will be for the last 3 months. A higher A1C is greater risk for complications and or need for follow-up. A lot of doctors now, as I understand, are after a certain age, and some issues that you might be having are taking that A1C blood test. And surprisingly enough, some people are on the high side of an A1C test. A higher A1C is greater risk for complication and or need for follow-up. Now, normal fasting blood sugar is less than 100 milligrams. 100 to 125 milligrams are pre-diabetes. 126 milligrams and higher are diabetes. This is depending on the lab that you go to. This is generic. This is what they're saying. The research has it. Normal, less than 100. Well, sometimes your doctor might say, you're at 100. I really want to watch you, or maybe you're at 101. There is something going on. So A1C is extremely important, and they don't order it all the time, but they order it if you come in with one of those symptoms that are suspicious, perhaps, of diabetes. Type 1 diabetes and insulin. Type 1 diabetes usually starts in children and young people under the age of 30. Remember the student at Penn State who was about 21 years old, not even, and he never had anything else at all, because afterwards we talked to the doctor, and it was just a shock to us. So it is generally in children and young people. It replaces blood sugar for those people who do not make enough blood sugar or none at all. That's what the insulin is for. The person's own immune system destroys the cells in the pancreas. We already know what it's doing. So insulin is prescribed for persons not meeting their A1C goal. And they have long and short-term acting insulin. Now, insulin is one of those things that it was discovered in, I think it was 1922. And it was discovered in France. It wasn't discovered in the United States. And there were people that were saying, well, what is this? What is this insulin? And it's for a diabetic. Well, they really didn't know what diabetes. I mean, people died with diabetes in 1922. So they did start using it from France over here, but very, very limiting. But also, the insulin at the time was not what we know as insulin. So it would give that person who has a higher A1C or a higher blood sugar level, perhaps feeling better for a year or two, but it certainly wasn't where we think of, well, I'm taking insulin and I'm okay. I could do everything with good lifestyle choices. It's not that way at all. Type 2 diabetes, medication. One of the oldest medications is metformin. It was discovered by Dr. Gene Kern in 1922, but it was never FDA approved to 1995. So there was that discussion back and forth, back and forth. Should we use it? It's safe, but metformin can be used for other things. So the doctors and specialists were saying, I'm not sure this is going to work for us. So they did wait, they did research. So in my opinion, by this time, 1995, it works. But look how much time that we had that we could have been doing something, because, you know, during World War I, World War II, we didn't have insulin as an option. We had some things that seemingly they thought would work, but this was in 1995.
Metformin, do you take it by pill or injection, or how do you?
The insulin, metformin?
Metformin.
No, by pill.
Okay.
That's why it's so wonderful.
Yeah,
it
that's
really
the thing. I would
is.
hate to.
No, right. So 120 million people worldwide are prescribed this medication because it is safe and it does work. And so I feel comfortable with the idea that how much research was done to make sure that it was approved by FDA, and it was approved. My husband's on metformin. He has absolutely no side effects, nothing, but he also eats tasty cakes all the time. So
How old is he?
my husband,
Yeah.
he's 78. Well, he's actually 79. I don't want to say that because I'm real close to him. We all say we're a good 78. So anyway, but I was very comfortable in that fact that it took that long because they wanted to make sure, because look how many people have type 2 diabetes. I mean, it's amazing.
Yeah, I visited a friend in a nursing home, and I asked the nurse, what percentage of your patients have diabetes, and she said 1/3.
Yeah. Well, since you brought it up, I hope everybody heard the question. You were visiting a patient in a nursing center, and they were talking about diabetes, and the gentleman said, well, how many people have diabetes in your center? And she said about 1/3 of the patients have it. But interesting enough, I'm glad you brought that up. I was at a dress shop, and it's really, it's a very popular dress shop, and they have this one area where you can, pay, only one area where you can pay your bill. And that day, which was last week, they were collecting money for diabetes from everybody that's going to pay. So everybody, was getting their purse out and wallet out, whatever. And I thought to myself, and then, because you have to wait so long, I thought, then people started to talk about diabetes. They started to talk about their friends that have it. One said, my granddaughter have it. I mean, you could hear everybody because, we don't do the 6 feet apart in stores anymore. So I heard all these conversations, and I thought to myself, here, I'm going to be teaching this, and that's so significant that people are talking about it. They were reminded because they were donating money to the Diabetes Association. But it is very, very prominent in our country. Another one, type 2 diabetes, is Trulicity. It lowers the A1C, we talked about that, and also loss of weight. Now this one, you do administer by injection. It's already pre-measured, it's a single dose pen, and provides treatment weekly. I think that's really wonderful. More people are on this Trulicity because it lowers everything and you don't have to deal with it every day. And you can't take it if you're pregnant or inflamed pancreas. We know that pancreas is producing insulin, or a severe GI upset. So that, again, Trulicity is given by injection. You can inject yourself. They are pre-filled packs, pre-filled syringe.
Do you need to refrigerate this?
I think you do. I think you do. But, it comes in a packet. And, but I think the biggest part of this, people are using it. But the other big part of these medications now, there are so many that are out there that were never there before. So I tried to pick two. The one is the metformin, which is a standard. The other is this Trulicity, because it is so nice for people that want to do it, and they only have to be concerned once a week. And so that's one of them, I think, that is, makes it a little bit more special. Is there a cure for diabetes? Current research demonstrates that significant weight loss can control type 2 diabetes. So we know that, that's type 2. A healthy diet, low in carbohydrates, including cutting calories, may offer a lower A1C. That A1C is everywhere. Once you see A1C, that's the gold standard to find out whether or not you should be testing for diabetes, or your doctor will say. Always consult with your physician, nurse practitioner before starting any diet. We know that. But I think it's so important to understand that we have to do it. Yesterday I taught a class on medication management, and part of what I talked about, it's all about us. Nobody is going to put that pill in your mouth, give you a glass of water, keep you on time. You have to take a medication every night at 5 p.m. because that's something that you need to do, and you forget it. And people do. People forget medications, and there's so many things that go along with medication management. The other part is we are responsible. We are the person that's putting that pill in your mouth at 5 p.m. because that's what the doctor said to do. So we really have to make sure that we're doing all of the things that will keep us healthy. There is a blood glucose monitoring system. So if you have type 2 diabetes, type 1 diabetes, you have to monitor what's happening. Your doctor is going to say, I want you, got the A1C, we're doing, some doctors will say you have the A1C, and then we want to do a 6-hour blood sugar test, which means you're going to have, go into the laboratory, you're going to have your blood taken every hour on the hour. And they really don't like doing that, but A1C is significant, but they want to find out, in order to give you the right medication, that they have all of the information that they need. So the blood glucose monitoring system is for type 1 or type 2. It's a diabetic meter using blood from fingertip, forearm, or palm. It's very small. It's about, the little monitor is about, I would say, 2.5 inches high and about 1/2 inch wide, so it's very small. And in that monitor, the meter is battery operated and comes with a cute little carrying case, so if you have to take it somewhere. It has a lancing device. Only a speck of blood is required. So you have to stick yourself, and again, it could be fingertips, forearm, or palm, and only a speck is required, and results are in 5 seconds. So that's a good thing. And then you look at that result, and you want to, in the beginning, you generally mark it down to say, well, I took it in the morning before I ate anything, and my blood glucose was 110. And you're really disappointed, but now you know what you have to do. Next day you do it, and then you get let's say you went down to 95. Well, you want to celebrate. You want to have a chocolate nut sundae. That's not the thing to do. But it really works. And the best thing about those blood glucose monitoring systems, they store 500 test results. So if your doctor says, okay, now you're doing it, you can just print that out for them and say, yes, I am. This is what my 3 months worth of monitoring this, using this blood glucose monitoring system. It is less expensive than other systems, but it does work. But it is, again, it's work. You have to do it. And some people don't like pricking their fingers. I am one of them. As I said, my husband is a diabetic, and every once in a while he'll say, why don't you take it? You see what I do, and I'm a nurse. I don't want to take it. I'm fine. If my doctor says I need to take it, I'll do it. Anyway, he laughs. There's a glucose sensor, and what that is, it's, I don't know, that's advertised on television all the time. It's just a little plastic thing. You put it on your forearm. A lot of people put it on their belly, right here above the belly, above your pant line, and it monitors. It's the size of a quarter. The sensor is placed on upper arm that eliminates need for finger sticks. Transmits glucose data every minute. Glucose sensors have offered a tremendous sense of comfort, especially for type 1 diabetics. And that's when people use it, because if not, sometimes their blood sugar is up and down like this, sometimes they would have to prick themselves 3 times a day. So you see with diabetes, and if you know anyone and that is a diabetic, it's really worked to keep themselves healthy. And this sensor has absolutely done miracles. And now they're advertising, I think that little finger prick is going to go by the wayside, but it's very inexpensive. I think it's like $10 for the whole kit. And these go up in price like $60, $70. But again, if you don't have to stick yourself and you are being monitored for your blood glucose levels, you don't have to take it. It's just there all the time.
Do you wear this thing all the time?
Yes,
Okay.
You just, it's like, I don't know how they do it. It's
No,
like,
one of the alternative was when you want to read and you stick it against your skin.
no,
and
no,
it
it's
fits
just
back in the door.
you have it
Wear all
on.
the
It's
time.
like a little glue, not glue, a
Band-Aid?
tape. It's like tape. But it's plastic. I mean, it really is, it's significant. But not big, it's just significant. But it does work, and as a matter of fact, I had to go to physical therapy for my back. And the physical therapist had one of those on. She used to keep it on her arm. So I asked her, and she said, oh, what a miracle, because she shared with me, I have type 1 diabetes, and she said they can't really control me properly. But with this thing, I know if it's low, I drink something, I eat something. So it's better for me because I can keep myself healthier and not have to worry about, should I take it? It monitors all the time. Meal tips during the holidays or other social events. Planning ahead. Do not let the usual high-fat and high-sugar holiday party take you by surprise. If you're going to a party or gathering, go prepared. Try to anticipate the types of food that may be served. If you don't think there will be food you can eat, consider eating a snack beforehand. That's really tough, because if you're going to a gathering and there's all this food around, I think that your body is going to say, I want that cheese and crackers. So, if you don't think there will be food you can eat, considering eating a snack beforehand. I said that, but I love this. Another alternative is to bring a snack to the party that you can enjoy and also share with other party goers. To me, that was the best plan, because you've made it, that, and you can make doubles, and the hostess is going to be so thrilled. Something that you like, because you're going to be eating, that's what you're going to be eating. But I thought that was really a good idea. So recall, as we're talking about things that you can do, this does not go away. And if you have a friend or family or acquaintance, they really have to work at staying well. And just think, if you don't, how lucky, I guess would be a good word, but also you have to really be involved in your lifestyle choices and your own health. Nobody can do it for you. Hydration, excuse me, a priority for everyone. If you do not get enough water, you may feel sluggish or cranky, but also the body is not able to pump enough blood to the heart, brain, kidneys, or muscles. As a result, your organs do not run well. And that is true. Hydration is a good suggestion for everyone. Excuse me, I had to have a glass of water. I think just reading the slide is what did it to me. So, hydration, a priority for everyone. Hydration is a good suggestion for everyone. Now, this was part of the, for diabetes, and I didn't want to put anything in there that would focus on pre-diabetic or type 1 or type 2 diabetic. I'm just saying hydration is good for everyone. And I think if you don't drink enough during the day, you really should do that. I think if anything else, hydration and activity are going to keep your bones better. It's going to keep your mental health better. So water is the greatest thing that you can do. No, you don't need anything else, but water is so good for you. But also that physical activity is really good for whatever, as I say, whatever ails you. So now I'm saying thank you for your participation. I would like to find out if anybody has any questions to ask me.
What is a good A1C number?
That is a very good question, and I should know it.
I guess I was told recently, we gentleman and I was at a class, and one of the instructors was saying, 5.7 is below that is you're good. If you're between 5.7 and 6.5, you're pre-diabetic.
Yes.
If you're above 6.5, then you're got type 2 diabetes.
Right. I just had a flash. You're absolutely right. And when they do that, again, that A1C, they're looking for something. So early on, I think I did mention the level of the A1C, but you're absolutely right. Thanks for adding that. So you want to be below the 7, and you want to be like 5 is good, 5.5, but that's what triggers whether or not you have something that they have to either start medicating you with or do more tests.
And I think she said the other day, 7.5 is what a new guideline or something.
Right.
They try to keep, if you keep it in that range or below for type 2, you're doing well. You know?
Well, I think the other
It's a
fact.
good goal to get to.
Right, that's another good thing to say. But the other factor I have noticed, that if you switch laboratories, you really have to make sure, and I always keep your lab tests, always keep them, but if for some reason you had to switch, look what the normal is for that laboratory. Don't get shocked if you're a little bit higher or a little bit lower, because there are some ranges and some equipment that they use that might be, it's normal for that laboratory. So just keep that alert too. I think sometimes when you see it, if you go to a new lab, I know I generally go to Jefferson or Chestnut Hill, and sometimes there's a range difference, but it's still within normal.
Could be calibrated wrong.
Yeah, it could be.
Yeah, I think you had mentioned you were talking about deciliters, and I mean, you looked like you knew what you were talking
The
about.
milligrams per deciliter.
Yeah, yeah.
So I made my living in chemistry, so that's.
Okay.
He's pretty good.
He's pretty good. I believe him, right. So any questions that you have?
My doctor said my numbers would come down with weight loss and exercise. That is true.
That is absolutely true.
Okay.